Urinary tract infections. Everyone knows how miserable they can be. The burning, the urgency, the constant running to the bathroom, antibiotics, one after the other. But here is something that might surprise you. Most of the urinary tract infections are actually caused by one specific thing. And once you understand that and how it works, you can dramatically reduce your risk of getting another one. I'm Dr. Aziz. I'm a urogynecologist and pelvic surgeon. Today, we're going to be breaking down exactly what causes most of the urinary tract infections, why it happens in the first place, and what you can do about it based on clinical evidence. No myth, no other tales, so let's get right into it. The number one and most important cause of UTIs is a bacteria called E. coli. So now, E. coli naturally lives in your intestinal tract. It lives there. It helps with digestion, and it's completely normal and harmless in your gut. The problem is when the E. coli starts traveling from where it belongs, like the rectum, to where it doesn't belong, like the urinary tract. So when the E. coli enters the urethra all the way to the bladder, this is when it starts developing a urinary tract infection. The data is clear. Approximately 80 to 85% of all urinary tract infections are caused by this single organism. Okay, but why is the E. coli so good at causing UTIs or causing an infection? Why not other bacteria? Well, the answer lies in how this bacteria is actually designed. E. coli has specific structures on its surface, something called fimbria. Think of it as like tiny projections that makes it act like Velcro. It allows the bacteria to stick to the inside of your bladder. Once they attach, they're very difficult for your body to flush it out or even urinate. This is why most UTIs, they don't just go away on their own in most cases, because the bacteria is literally clinging to the bladder and multiplying, causing inflammation, causing symptoms like burning with urination, pressure, urgency, sometimes even blood in the urine. The other question that I get asked all the time, why do women get more UTIs than men? So that's very important to understand. Women are like 30 times more likely to develop UTIs than men. And in fact, about 50 to 60% of women, they will experience at least one UTI in their lifetime. So why such a massive difference? It comes down to the anatomy. Women have much shorter urethra, which is the tube that carries the urine from the bladder to the outside of the body. The female urethra is only about 4 centimeters long. Compared in men, it's about 20 centimeters. That means the bacteria, they have much shorter distance to travel to reach the bladder in women. Also, the female urethra is located very close to both the vaginal opening and the anus. This proximity makes it easier for bacteria from the rectum to accidentally migrate to your urethra and then ascend into the bladder. So how about the E. coli? How does it get from your gut to the bladder? So the actual route that the bacteria takes is important because understanding this will help you understand why certain prevention strategies work. The most common way E. coli gets from your rectum to the urethra is through what we call fecal contamination, whether that's perineal or urethral contamination. In plain English, means the bacteria from the stool can spread to the area around the urethra. This can happen in many ways. After bowel movements, with wiping, if you wipe the wrong direction. You're supposed to wipe front to back, not back to front. Also, during sexual activity. This is one of the most common triggers that we see, especially in younger patients. The physical contact during intercourse can push the bacteria from the vaginal and rectal areas towards the urethra. In fact, sexual activity is such a well-established risk factor that we even have a term for it. It's called honeymoon cystitis. Poor hygiene is also important. While almost all women, they have good hygiene, certain practices can definitely increase the risk. Like, for example, wearing tight, non-breathable underwear that can trap moisture, not urinating very frequently, especially after intercourse, The key point is proximity matters. The closer the bacteria is to the urethra, the higher the chances that you will get an infection. Okay, so all of this information is great, but what can you actually do to prevent them? This is not just my opinion. This is evidence-based medicine. So one of the most important things that I tell patients, especially if you're sexually active, try to urinate after sexual activity. It's very easy to do. There is no risk to it. Urinating within 30 minutes after intercourse can help flush out any bacteria that may have been pushed towards the urethra during sexual activity. This can reduce your risk of getting urinary tract infection. We talked about hygiene, wiping front to back. Always wipe front to back, not the other way around. This prevents the bacteria from the rectal area from being dragged towards the urethra. It is simple, but it matters a lot. Always stay hydrated. Drinking enough water throughout the day helps keep your urinary system flushed. So when you produce more urine, you naturally eliminate bacteria more frequently. Aim for at least 6 to 8 glasses of water daily. Do not drink them all at once. Try to spread them out throughout the day. Also, very important, don't hold your urine. Good bladder habits is trying to urinate every 2 to 3 hours. This prevents the bacteria from sitting in your bladder too long and multiplying. So if you're not urinating for extended periods of time, bacteria has more time to basically attach to the bladder wall, multiply, and cause an infection. There is also one supplement that I highly recommend, which is the one that is most backed by science, which is called D-mannose. It's an over-the-counter supplement that you can take, and it can actually prevent recurrent UTIs. D-mannose is pretty much a very concentrated cranberry. It attaches to the lining of the bladder, preventing the bacteria from attaching to it. The research and the studies have shown benefit, particularly in women with recurrent infections. Cranberry juice by itself or cranberry products, they actually don't work very well unless you take really high quantities from that, but that contains a lot of sugar. So it's better to take the D-mannose. So if you're getting a lot of UTIs, try to do some of these prevention strategies that we just talked about. Most of the time, they help get rid of those UTIs. However, if you feel like it's been 6 months or longer and you're still getting UTIs back to back, this is the time to talk to a provider, a urologist or a urogynecologist, because you might need an evaluation, you might need a physical exam, you might need a workup to make sure there is nothing else that is causing you to have regular infections. Which get me to the point that how would you know that you have a UTI? This is very important because there is a lot of conditions that can have the same symptoms of a urinary tract infection. However, the number one thing, burning with urination or pain with urination is the most common symptoms. You feel that burning when you pee. You feel strong urgency to urinate, like you gotta go right away. And you're urinating more often, sometimes in smaller quantities. You might feel pelvic pressure. You might feel pain in the pelvis or the lower abdomen. You might see blood in the urine. If the infection gets complicated or gets severe, you might start developing fevers or chills, nausea, vomiting, back pain. That's a sign that the infection is starting to spread to your kidneys or your body. And this is actually a medical emergency that requires immediate medical attention. So do not wait on that. Don't try to tough it out if you're suspecting a UTI. See your healthcare provider, get proper testing, get proper treatment, because untreated urinary tract infections can lead to more serious complications. Remember, this information is educational to give you the knowledge to be able to realize when you have a urinary tract infections and things that you can do by yourself to prevent them from coming back. However, it does not replace medical care. So if this is something you're struggling with, please see a healthcare provider. If you found this video helpful, please subscribe to my channel, give it a thumbs up. I create a lot of content on general health, urology health, pelvic health, and wellness. Leave a comment below if you have any questions and let me cover it in the future videos. I'm Dr. Peter Aziz. Thank you for watching.